I'm Dr. Scott Fuller. On this segment, I'm going to talk about abs or abdominal exercises. Too many people come into my office hurting themselves, hurting their back and their neck by doing intensive ab exercises. So I'm going to show you safe ab alternatives on this segment. I understand that not all of you are going to agree with what I'm going to say, but the average person that's looking to get some abdominal work and maybe have had some back problems and some neck trouble, and they're concerned about those areas and they want to protect them. So they don't want to sacrifice the health of their neck and back while they're doing abs. That's the purpose of this segment here. I'm going to show you some safer alternatives. In my book, Happy Back, I also have a chapter dedicated to abs because I see so many injuries coming into my office from abdominal work. Here's the reason for some lower back pain. The psoas muscle comes from the leg bone and it attaches to the lower back. So on the skeleton here, that muscle comes up and it has attachments to the discs and joints and soft tissues in the lower back. So any ab exercise that has the knee coming up like this, or a leg lift is usually the biggest culprit, that's going to activate the iliopsoas muscle, the psoas in particular, tug on these discs and joints, and for some people that's going to cause some trouble and pain. Not all of you, but some of you. So that's why we want to be cautious of doing those types of exercises, of doing anything that the legs come up or the hanging knee ups and so forth. I also don't recommend an ab machine at the gym where you are sitting down and then you do this crunch like so. I think there are safer ways to get the same work done. That's what I'm going to talk about. Now, if you have a personal trainer that you're working with and you are having some neck and back issues, talk to your trainer before the class and say, we're going to make some modifications here. All trainers are completely, totally fine with that. As a matter of fact, when they have a class of people in front of them, they'll say, if you can't do this or can't do that, or if you're having pain, go ahead and do those alternatives, and that's a good idea. Okay. So the first one I'm going to show you is what I call a safe crunch. I'm going to hop down on the floor here and show you that. This is a safe crunch. A couple of things. On your back, you're going to put your feet up on something, okay? So feet up like this. The next step is to take your knees and pull them closer to you. What you're doing with this is flattening out the lower back and taking all of the pressure off the lower back. You're isolating your ab muscles and you're taking the leg muscles out of the exercise, and all of that is good. Next step, put your hands behind your head and hold the weight of the head in your hands. Notice that I am not going to be tugging on my head like this. I'm just going to let the weight of the head drop into my hands. And then you're going to use just your ab muscles to pull yourself up. Here we go. This is me doing a crunch. And this is what I recommend for you. So notice again, I'm not coming up very far. And if you want an extra burn, if you're pretty good at this, pull up like so and hold, like you're doing a plank. And we'll show you a plank in a moment. And then let yourself down. And then pull yourself up and hold yourself even longer, 30 seconds if you want to, or a minute, and then down. With this safe crunch, as I'm calling it, you can also do obliques. You can turn and come up like so and hold. And you can turn the other way and hold. If you do 30 or 40 of these, if you're in shape, if you're not in shape, you won't be able to do quite as many. But if you do 30 or 40 of these each side, holding each one like I'm showing you here, you're going to feel it. Great ab work, and it gets the lower abs as well. I call this the safe crunch. Show these to people all the time. I've been showing my patients for years, and a lot of people love it because there's no stress on their neck, no stress on their back, and they target their ab muscles. Great exercise. You can do it every day too if you want to. Okay, next, I'm going to show you a plank. Planks are good with a slight modification for some people. Here's a plank. Now you can do planks on your hands, you can do planks on your elbows. I'm going to show on your elbows. Here's the elbow plank, like so. Now, here's a traditional plank. The body is nice and straight, like so. If you have some back issues, kick your pelvis up towards the ceiling a little bit higher. You're going to be taking pressure off of your lower back, but you're still engaging your abs and getting the exercise that you want. That's the modification. For side plank, there's no modification needed. You're just going to be on your side like this, elbow or hand, and that would be a side plank. Most people are fine with that one if you can do it. They're not that easy. So those are the modifications that you're going to do. You have the safe crunch. You have the modifications to plank, which you lift yourself up a little bit higher, and then side plank is usually fine if you can do a side plank. Okay? The other key to abs is this. Most of you know this. Let's say I was a guy with a big spare tire here, okay? And I say, I'm going to go on a campaign and I'm going to do 500 crunches a day for 6 months. So I go ahead and engage into this, and 6 months later, I still have a spare tire here, but I have great muscles underneath it. So I didn't really kind of get anywhere. Most people know that to trim this area down, we need better dietary choices. And it would be more effective if we took that crunch time and actually walked on a treadmill or did some elliptical or did some cardio to actually burn some fat. So we have to eat better and burn fat to trim this area down. The secret to a good abdominal area is not necessarily a whole bunch of crunches and planks like I just showed you. It's actually the dietary choices and more cardiovascular exercise. So good luck with this. I'm Dr. Scott Fuller. Please join me again.